So good afternoon, one and all to our viewers, our special viewers who have been taking in our sessions, our interviews, all our events on our Massage Awareness Week 2020. I am Kanta Clouden with the Caribbean Association of Massage and Bodywork Practitioners, CAMP for short, in case you can't make it out. And I'm here today chatting with the very sensational.
Hi, I am Rhonda Wilson.
Hi, Rhonda. For those who would have seen the first video we posted on Saturday for when Ron and I were chatting about the COVID protocols, you may remember her from then. So today we are chatting with her personal journey in the massage industry. And before I say that, I'm just going to remind us that our theme this year is virtual wellness, a pandemic necessity. So my therapist journey with Rhonda Wilson starts now with Rhonda. What is your professional experience and who is Rhonda Wilson? Please tell us all. I am listening.
So I am a licensed massage therapist and a trained birth doula. I provide my therapeutic services as the Euphoria Wellness Clinic. I am a class of 2009 graduate of the College of Therapeutic Massage and Beauty Culture Limited, where I acquired my diploma and license, TTMA 193 in 2009. Since then, I've continued my education, acquiring certificates in sports massage, musculoskeletal injury taping, geriatric massage, which I've lovingly coined elders massage in my practice,
I like that,
pregnancy
elders
massage, pregnancy massage, contemporary chair massage, suction cupping therapy, shiatsu massage, traditional post-pregnancy massage, which included not only massage to promote the healing and recovery of women who have given birth, but also in the traditional herbs used to aid healing, cleanse the body, and promote breast milk production. As a part of that course, I also learned about traditional herbs for the 6 and 12-day bath ceremonies. Most of these herbs I now have planted in my garden.
You're a herbalist now?
Yes. The course also taught us infant massage and the treatment of Hasseli, which is a neck strain in infants. It was a first of its kind course facilitated by Miss Marcelina White, who combined her grandfather's traditional work with her formal knowledge and training as a massage therapist. I also recently acquired certificates in aromatherapy for massage, basic breastfeeding management for doulas, which complements my training as a birth doula. And I know what your next question is going to be, Kanta. What is a doula?
Please.
So a doula is a person trained in the physiology of birth, and we are trained to support women in labor and their partners as they navigate through the changes from one stage to the next of labor. I provide continuous support from the onset of labor through the different stages. I stay with my clients in the birthing room as they give birth, and I stay until baby's first breastfeeding. So during the time that I support my moms in labor, I provide comfort aids, physical support through massage and assisting them into positions which have been proven to make contractions or surges, personal power surges as we like to call them, as the less painful and more effective. I provide informational support by providing clarification when necessary to facilitate informed decision making. Sometimes your doctor comes in, you in the middle of a contraction, and he says something or he tells you what the next procedure is going to be, and you don't necessarily hear it because of where you're at in the, in what stage. So we are there just, if you need to ask an extra question or you need something clarified, I can give you that information so you can make an informed decision on the way forward. And we also provide emotional support. Sometimes we plan and plan and plan, but birth is very unpredictable. Every single birth that I've attended has been different. Every woman's reaction is different. Sometimes something changes, and we are there to just kind of help you center and refocus on your breathing, on your outcome. and adapt to those changes that may happen.
And you
So
would have personal experience with birth being it's different for everyone because you yourself are a mother,
I
correct?
am. A
So
mother.
you have
I have
that
two
experience and
babies.
to be able
Yes,
to be that support, as you said, as a
correct.
doula.
So as someone who has gone through birth, I can relate to a lot of the changes that we go through during different parts of the process, as well as interacting with medical professionals, because birth has become so medicalized. They focus on the medical part of birth, sorry, and the birthing process, your blood pressure, your blood sugar, baby heart rate. So they come in and they tinker with the machines and they do their procedures, but they're not always conscious of what's going on in the birthing person's mind, the fears that she may have, or the apprehension, or that question that she wants to ask, but she don't want to ask the doctor because she don't want to feel silly or get
Yes.
an answer that may not sit well, kind of thing. So we are there as that buffer, as that support system, just to support them through their best birth outcome, so that they know that this one person is there from onset of birth all the way through. There's one continuous person there to support you, the birthing mother, and I am not there. I do not support the doctor, the midwife, the nurse doing whatever. I am there to support you and for your best birth experience.
And when you say you mean the mother, the
The mother,
expectant
the
mother.
birthing mother. Yes.
So in all this, because you seem to be a very well-rounded therapist, how did you, was there someone who inspired you to become a massage therapist? Who or what inspired you to be a massage therapist? And when you were in training, was there someone or some persons who, you look to say, well, I want to emulate them or to learn their techniques? Just tell us a quick
So
bit.
in terms of inspiration, I gain inspiration from everywhere. Um, when I was training, I gained a lot of compassion and a lot of drive and appreciation for massage therapy from my fellow classmates. When we got to the point in our course where we were sharing massage, I was amazed at, the way all of us learned this basic principle,
Yes.
and the way each of us adapted it to our own style, to our own personality, the way our hands moved, the way our bodies moved. Um, and just I really do stand in awe of massage, having received the massage as well as having given massage, and the effects that it can have, the way a muscle feels when it's strained, when it's shortened. I gained a lot of inspiration from my family. One, in wanting to provide for my family, and in our own experiences with conditions, and the way we handle them. We are very traditional in the way that we do things. So my grandmother she was the woman, something hurting you, look, put this on it, rest her one that you will leave on it, sapping her knee with bay rum, we would sit down and massage her hands. She was one of those persons always in the kitchen, cooking. You could never pass by us and it didn't have food. She could feed 4 or 5 people when she finished cook, and that was amazing to me. And I remember being very young and doing, massaging her hands or her feet, and her talking about life in Grenada, just, how different things were from then to now. I also had one really terrible experience in Grenada where I fell and I almost broke my ankle. I was on crutches, and according to the doctor, I would have been on crutches for maybe 2 months. And we had an elderly neighbor that we lovingly called Mamori. And she saw me with the crutches, and she told me, come by me. And I went by this lady. She had some soft candle and her corn hawks. And she rubbed my ankle every day for a week, 1 week. And I was able to walk, not with crutches, but with the stick. So that was my first experience in having somebody massage me in that traditional sense. And it was interesting to me because it always kind of stayed with me that the doctor said 2 months, and within 2 weeks I was able to get up and move around.
Corn husk and soft candle, you
A
said, right?
corn husks and some soft candle. I had to roll my foot on the corn husks, and then she would take it and she'd rub the soft candle and pull and bend and rotate my foot. It was, I mean, I was in tears the first couple of days, but it worked. And since then, I mean, since I've done my classes, I continue to draw inspiration from our massage ambassadors. So Mr. John Davis, who is always willing to share his vast knowledge.
I agree with that.
Miss Marcelina White, with her wealth of traditional knowledge as well as sport therapy. She is one of the key persons who has really kind of pushed me out of my comfort zone. She's one of those people who's like, you could do that. And I'd be like, nah, I don't think I could do that, you know. She'd be like, no, you could do it. And, you know, kind of buffet into, she's kind of buffet into submission. But when she pushes you, it usually has a fantastic outcome. She's like my work mom. She's work mom and Mr. Davis is work dad. If I need advice on something, they're the people I normally go to. And I mean, from the roots of my professional training, Miss Gopal and Mr. Pravin Gopal, without whose foundational expertise I would not have been able to follow my passion and really realize how, you know, rubbing granny's hands or rubbing my mom's feet could be transformed into something that could really heal and help people and understand the physiology of the body and the way different systems work. I mean, they have definitely been and continue to be my inspiration. I love when we have Therapist Day and I watch all the different modalities of therapists.
Yes.
I mean, it is amazing for me to watch. And I learn from watching them, from getting massages from them, from doing massages on them, feeling the different muscle groups that are developed due to the way they do what they do. And I mean, like I said, my inspiration comes from all of that.
So any advice you have for therapists then?
Most importantly too, from my clients, from when I work on our clients and the client says, hey, you know, I never get a massage like that. Or, you know, this thing been bothering me for such a long time and I feel relief. That inspires me every day to keep learning and keep doing research and keep fine-tuning my technique so that I can adapt it to whatever situation that I find when I work with my clients.
So as therapists, we need to listen to our clients because it will, as you said, it prompts you, it encourages you, it pushes you to go searching for how can you better improve, or how can you improve if necessary.
On the technique for their treatment, yes.
Correct, to be able to, you know, attend to their needs better.
Yes.
Because you always want to hear, as you said, I didn't get a massage like that before. Especially if you were the first person, you know, the first time they were getting work from you, you want to feel that level of, okay, I did good.
Accomplishment, yeah. Okay, I genuinely provided a successful treatment outcome for this client.
So what's been happening now with COVID? You know, people haven't been able to, I mean, no touching, group gathering, you know.
I was really concerned about COVID because, I mean, you can't social distance a massage.
No.
I was concerned about client reactions because I did have some cancellations due to people being overly cautious. And I mean, it was a little touch and go, you know, in rebuilding the client confidence afterwards. But I have always been very stringent in my cleaning routine because I am an on-site therapist, because I go to my clients and I do massages in different environments, the savannah, at their house, you know, sometimes outside their house or inside a room with air condition. Cleaning has always been one of, my top priorities. So it was really about getting the confidence of the client. So just reaching out to them and letting them know, hey, I'm still here. I am still working. I am following all of the protocols to ensure your safety and mine. So we had to add masks. Really, I increased the cleaning regimen. So things like going into people's homes, like with your shoes. I have a pair of shoes, a pair of slippers essentially. If I have to take off my shoes, that stays in my car. I spray it with the rubbing alcohol before and after. Or if I can't go in with my shoes, I spray my shoes in rubbing alcohol and I rub it off just to make sure that I don't track anything into their house. I offer, if they prefer to do their own sheets, they can provide their own sheets. Or I do when I do the setup, I do a little extra spray on the sheets with the rubbing alcohol just for that extra sanitization and more for their peace of mind, so that they know that what they're coming into contact with is cleaned and sanitized. I clean my car more frequently. So if I come from one client to the next, I have to clean my seat belt. I spray my clothes with rubbing alcohol. If I'm going to a client that is high risk, my pregnant clients, my elderly clients, if they are not the first clients of the day, which I try to make them the first clients of the day. If they're not, if they can't do an earlier appointment, I have a change of clothes in the car. So before I go to them, if I went somewhere else, I would change my clothes to ensure that they are protected from anything that I would have come in contact with before. Of course, wash hands, sanitize. I actually work with hand sanitizer in my oil pouch. So this is the oil pouch, there's hand sanitizer and then the oil. So if for some reason I have to touch something that is not the table, or I have to get something out of my bag, or they ask for something, they want their phone or the remote for the air conditioner or something, I can sanitize my hands and then come into contact with that and give it to them. So I'm really, really just maintaining all of the necessary protocols, and I find every way possible to protect myself and my clients, because I too have small children and an elderly mom. So just as how I don't want to take anything to my clients, I don't want to take anything home. So, the cleaning routine at home is, none of my work clothes go into the house. There's a hamper outside by the washing machine for those clothes, and straight in the shower. Once you take off, leave everything in the hamper and straight in the shower before I interact with anybody at home. Spray the trunk, spray the bag, spray the case, so the massage table, etc.
Yep. Something you mentioned, which I think is a very good tip for therapists listening. As you said, you try to schedule your high-risk clients first thing, first thing up in the day. Would it be a 1 o'clock appointment if they're your first appointment for the day, but you try to schedule them as your first appointment for the day? That way,
yes,
it's less contact with the outside that you are bringing in. And then, as you said, also your change of clothes. So everyone listening, that is a very good point. Try to schedule your higher risk clients first. All right.
Yes.
So, my dear, I know you mentioned that you go to your clients, so you are mobile like myself. So therefore, it's not that you're located somewhere, it's basically, where you're getting your work done is where you're located. So how can the viewers reach you?
I can be contacted by phone or WhatsApp on either 759-8179 or 345-0288. You can also contact me through my Facebook or Instagram page at Euphoria Wellness Clinic.
So, Rhonda, my dear, you also have touched on so many points and so many things, and it just reminded me to what you said earlier in developing your technique and your training. You mentioned, I believe it was the traditional post-pregnancy workshop with Marcelina White, and I did that workshop as well with
Yes, you were. We were both in that first class.
Yeah, were you my partner? No, it wasn't you my partner, but but that was a fantastic workshop. So
it was amazing to see the blend of traditional and more. Traditional in terms of from her indentured grandfather techniques to our more medicalized type approach. It was really, really interesting to see that melding of the two. into that course. I mean, she did a really fantastic job of meshing both into a comprehensive course for us.
And that's what camp is all about, in that, in meshing the different skills, the different personalities,
Yes.
the different therapists together to share each other's experiences and techniques, as we would have done in massage
And
therapist
therapist
days.
day. Yeah.
But as I said, everything is online now. We have been virtually um, celebrating our wellness week, our massager wellness week virtually. So
Virtually,
I hope
yes.
that all our viewers have enjoyed, as I have, this chat. It's not an interview, a chat with Rhonda for my therapist journey with Rhonda Wilson. So my dear, until I talk to you again, which I'm guessing will be soon, you have a blessed afternoon ahead
Just
of you.
before we go, I
Yes,
want
sorry.
to just add, for younger therapists coming up, I just want, you have to never stop learning. I don't think anybody can ever learn everything about massage therapy. Always keep learning. Always try to learn from the elders, from the pioneers of the business. Seek
Yes.
advice, remain humble, and accept all of the knowledge that is being provided to you. Focus on your body mechanics. If you want to prolong your career, focus on your body mechanics. Your body is your tool to treat people. We get injuries just from working with our clients, providing their care. Focus on your body mechanics. Develop a self-care routine. Just always learn. Just always keep learning. I myself maintain an empty cup philosophy. I remain in awe of all the different modalities and therapists that we have involved, that I have been able to interact with through camp therapist days, and which I miss it. My gosh, I miss it tremendously. But
I agree.
definitely keep learning.
Yes.
I continue to learn. I continue to look for new courses to add to my skill set to better provide care for my clients, more skills to add so I can customize each session per client. The next thing I'm going to add to my skill set is actually Lamaze instructor, and I'm going to do doula,
Training.
postpartum doula training. Yes. So postpartum doula training, Lamaze instructor are my next steps to providing a real comprehensive package for my pregnancy, post-pregnancy clients.
So you see,
And pregnancy
everyone,
and post-pregnancy clients.
Rhonda has a wealth of information, and Rhonda has been operating for, I think you said 2009, 2010? What year was it?
2009, 2000, yeah.
2009. So 11
2009 was when
years.
I graduated.
You have done a lot. You have done a lot of continuing education, and in those 11 years. And even though we're unable to have in-person classes, if you look, there are still classes, online courses that are
Yes,
accredited, certified, that you can find that will
correct.
complement what you're doing, or what you want to do in
Yes.
massage therapy and in the field. So
Mhm.
with that, Rhonda, my dear, we will chat again. And everyone, I am Kanta, and this has been my therapist journey with Rhonda Wilson. So bye,
Thank you
my
very
dear.
much for watching, everybody. Bye.